Rise early, make the road short. And City is looking at our guest this hour who has come in and told us, hey, the road was long.
I've been greeted by the drama that is Mombasa Road.
Anne Ngengere joins us. She's a social content editor with Viral Facts Africa. Good morning, Anne.
Good morning, Eric.
Karibu sana to the Situation Room.
Asante.
That's a hot seat for people who are adversaries, but for our friends, we like it being just a warm seat. And you're our friend. So it's just a warm one for you today.
Let's hope so.
Karibu sana.
Asante.
And also a very good morning to our audience joining us live on KTN Home. You'll be with us until the top of the hour. The conversation this hour is fighting misinformation. We've been having this conversation, curating conversations as we do in the Situation Room every morning. And this particular one is on the issue of fighting fakes. There's so much fake news right now in our society. Well, others could argue there's always been fake news in our society. It's just that this time there are platforms that actually amplify the fake news and spread the fake news much faster. And you work in an organization called Viral Facts Africa. Isn't that an oxymoron?
Why?
Viral facts. What's viral is what's not.
Well, not necessarily.
What goes viral is hardly the facts.
Well, so we want to make the facts viral now. Yes.
All right. So tell us about the organization.
So Viral Facts Africa is an initiative of the Africa Infodemic Response Alliance, which is a WHO-led initiative. So it brings together health organizations, health experts, and fact checkers that have been accredited by the International Fact Checking Network. Yes. So we work with agencies like the WHO Regional Office for Africa, the International Red Cross, UNICEF, Gavi, yes, and now the fact-checking organizations in Africa, 5 of them.
So your leaning is more towards health?
Yes, we do. We try to verify and debunk health information and bridge information gaps across the continent.
You have your work cut out for you.
Oh, yes, we do.
Because when you're talking about health issues, because I was listening to the organizations that you affiliate yourself with, and I'm thinking of the myths that exist around just the very subject of health. And some myths are very held dear. They are myths that people are not willing to let go of.
Yes.
And I'm thinking you are there to check the facts. Now tell me, how do you check these facts and how successful are you?
So we, number one, work to debunk information that has already been spread, like false information. So in this case, we work with fact checkers to debunk things that they are seeing or that have already been flagged as false. Number two, we also work with now the health experts to explain where there is a gap. We are not necessarily seeing misinformation, but we can see concerns that are arising on social media. People have started asking questions, so there is a vacuum, and that is what now is a breeding ground for misinformation to start circulating. So we reach out to technical experts to explain to us what is this. We explain now to people. We produce explainers and tell them, we've seen your questions. This is what we know. These are the facts, before the misinformation crops up.
Okay, in tandem with the name of the organization, give us an example of something that was viral, required debunking, and then walk us through the process of how you went about debunking it.
Okay. We've seen quite a couple of false claims. So one of them that was going viral, not only in Kenya, but in other African countries, is people started saying that people get vaccinated will die in the next 2 years. And I don't know if you saw that. Mm-hmm. Yeah, it was linked to a French scientist, Luc Montagnier. But it turned out he had not said this. So in such a case, you see people attaching quotes that are fabricated to public personalities, because once they see this is coming from a scientist or this is coming from a doctor, then they see this is true and they start circulating it, because it was very, very, very viral on WhatsApp. So in such a case, we partnered with fact checkers. Some of them had already debunked this claim, and we explained, number one, this was not even said. And number two, do not just share everything that you receive. When you conduct even just a simple search, if he said that, what the people who are circulating this misinformation are saying, there is nothing like that when you look at it online, when you search online. So in such a case now we tell people, pause before you share. Try and verify what you're seeing. Do not just forward as received because you're saying you've seen this, it's from a scientist. So, and in fact, that is one of the things we are doing, trying to promote digital literacy. Because unfortunately, with some of these things, they go very, very viral. Because like for that one, it really went everywhere. It was even offline. You hear it when you go to the salon, you hear it when you're in a cab. And now we're trying to tell people, before you circulate something that you receive, can you try and verify what you're seeing and putting out resources on how you can do this?
There's one popular one that has done the rounds on many, many occasions. It has had to do with vaccines being a family planning product as opposed to what it's supposed to do. Did you come across that one?
Yes, we have seen that.
Yes.
And it is not just, this did not just start with the COVID infodemic.
No.
We have seen misinformation about vaccines, like it started years ago.
Yes.
Even with the HPV vaccine, when it was introduced, the same thing happened. People say that vaccines will cause infertility, but this is not the case. So we try and tell people, this is how, don't just believe everything that you see online. Because unfortunately, all this misinformation is on social media platforms. So can you get your information from accurate and credible organizations?
Okay.
And if you're not sure about something, can you reach out? Or if you're still not sure about what you're reading, can you reach out to fact checkers who can then help you and walk you through and show you how they went through the process of arriving at this rating. If it's false, this is how we went through it. These are the sources that we used.
Okay.
And also use these sources in the future if you're not sure about what you're seeing, if it's related to health. Yes.
In today's world, the rate at which information spreads is unbelievable.
Yeah.
So that means also that the rate at which false information spreads will just be as quick as the other.
Yeah.
And you just talked about now communicating when you find out that something actually is false, communicating that to people. But it would appear that the damage by then has already been done, right? And if you get this false information on social media, for example, I was sitting in the company of my house manager the other day, and she read something to me off her phone, which was absolutely raw. It was false. You see, but it has already formed an image in the minds of people, and she spread it to whomever that she's having this conversation with. Now, the recourse, as you're talking about now, would be to give the right information. But does it go as viral as it did, as the false information did?
Unfortunately, no. That is one of the problems we see as fact checkers. By the time, especially if you're doing a debunk, where you've already seen the misinformation, but now you're now coming back to try and correct it, the impact, the damage has already been done. So it will not reach a wide audience as you would want. And this is where now the collaboration comes in. Because like for us, like I've mentioned when we started, we are working both with technical experts and with fact checkers. So we have like a content hub where we store all the content that we've produced. Because you have cases where you see misinformation, let's say like in Kenya and South Africa, let's say about vaccines infertility, right? So we produce a video or create image cards and, show the debunk. Then about 6 weeks later, you see the misinformation in Ghana. So now it makes it easier for our partners to just come, pick, we've already done it. So they amplify the content immediately and counter it. So there's no need to now start taking, because it takes time to produce a debunk. If you need to get a technical expert to explain vaccines and the reproductive system, it will take time. And by that time, the misinformation has already, spread on so many platforms.
Okay.
So in such a case, we work with our partners. They amplify the content. So we have people amplifying on over 60 channels.
Yeah.
So that kind of gives it, wider reach
Right.
than if we were just doing it by ourselves. Yeah.
In the time of COVID, I think we've probably seen some of the highest levels of misinformation
Yes.
that maybe we hadn't outside of political issues, before that. What are some of the things that stand out to you that possibly people are still believing today
Yes.
that has been wrong information that we still probably think is true?
When the pandemic started, we were seeing a lot of misinformation about COVID-19 treatments and prevention. Like if you remember, sometime in February, over 700 people died in Iran because they took alcohol with the false belief that it was going to cure them of COVID or prevent them from contracting COVID. So we've been seeing, like, the whole of 2020, most of the misinformation that was spreading was about COVID-19 prevention and COVID-19 treatments. And unfortunately, we are still seeing that now, where people now are saying, if you take this drug, you will be cured of COVID. If you take this antibiotics, you will be cured of COVID. And all these things are false. And that's why we are trying to tell people, this is not proven. This is what we know. If you get unwell, if you develop these symptoms, please seek medical advice. Do not just go saying, oh, I saw on Twitter that if I do this and this, if I steam my face or if I take this concoction, then I'm cured. Just go to hospital, get the proper treatment. So that's what we're trying to tell people. Don't believe everything that you see on social media. Yeah. Because,
go ahead, finish.
Yeah, health misinformation, unfortunately, the consequences are very dire. People actually lose their lives. Yeah.
I was about to say that the spread of misinformation, especially to this great extent, points a finger at those who have the information. Because it shows that misinformation is filling a gap. It's filling a void that exists. That people want information, but those that actually have the information are not being proactive in sharing the information. So those that you come up across any small bit of information, you consume it, you share it with somebody else who finds it relevant, they consume it. Fact checkers such as yourselves are being reactive, basically. You're coming to after the fact that the misinformation has spread to try and debunk. The organizations that you're working with, for example, that you work closely with, have you had a conversation with them about be proactive in sharing information? Better communication. We are talking about health and health matters. So what are those areas that are, flagged?
Yes.
What do people want to know? If they knew, for example, if WHO, if all the other organizations do that, this is what people want to know about health, about their health matters. Come up with the information and share it with them. Then you reduce the chances of the misinformation spreading.
Yes, actually, we have started being a bit proactive, what we're doing at Viral Facts Africa, because I mentioned we are working with fact checkers who mainly do a lot of the debunking. What we are doing now, we're also trying to do pre-banks, which is producing information to address a gap that we're seeing before misinformation starts circulating. So we have, like with the Africa Infodemic Response Alliance, we have a team that does social monitoring. So they look at what is circulating online. Sometimes it is questions, not people spreading misinformation, but saying, hey, I have seen this, or I got vaccinated and this happened. Is this a side effect? Or, that is not misinformation. It is a question. It is a concern. You see people having a conversation on social media. So we flag this and we're like, this needs to be addressed now. Before now, we have other voices with an agenda coming in to tell them, to fuel this, to spread the false narrative.
Sure.
So we are doing a lot of explainers, trying to tell people, if you ask a question, and asking them actually send us questions. If you have concern, use the hashtag VFA check or send us a direct message, and we will. Then we work on that. We do an explainer and tell them 1, 2, 3, and here's your question answered. So we're also trying to also be very, very proactive, because it is easier for you to do a pre-bank before the misinformation has circulated than now trying to come back and change people's mind after they have already seen something that has gone viral in so many countries.
Yeah, I think there's a lot of information that comes out which I would maybe describe as innocent proliferation.
Yes.
Is that it could be an old wives' tale, for example, surrounding COVID. Somebody has worked previously, like all this thing we talk about, steaming and etc. Somebody telling their child, and it's being put out there. So, and that's why I say innocently. Whereas we do have people who come up with misinformation or fake news intentionally. It's an industry for them.
Yes.
But looking at COVID, there are a lot of people who believed so many things, like, the ginger and the garlic and the this, that, the other thing. But because they've seen it work in other areas, it then became something that could be, for everybody to use. So how do you preempt something like that may have worked for somebody and they put it out into the public? How do you pre-bunk something like that works in somebody's personal life and they feel could work globally for COVID?
We tell people, like COVID itself manifests itself differently in different people. Some people have mild symptoms, others require hospitalization, So just because one form of treatment worked for someone else does not mean it will work for you. So if you develop these kinds of symptoms, please seek medical advice so that you get proper and effective treatment. Yes.
The information that you speak of is fairly straightforward and fairly easy to understand. But it has competition. And the competition is the popularly held myths that people have regarding these things. So Eric mentioned the need to inform in time. Now, just stating it, yes, is part of the information, but it doesn't guarantee that the information will be internalized. Because if it isn't internalized, then the debunking process is incomplete. The debunking process, in my mind, is complete when somebody has seen the alternative and has accepted the alternative, or has stopped whatever practice they had based on the myths or the misinformation. Now, your organization, what it does, clear cut, it is good. But you do it on behalf of others who actually have the means to actually understand why these myths and misconceptions arise in the first place. Because again, if you're debunking it and you do not understand the genesis, then again, you may not necessarily succeed in what you're doing. You will be heard, but as I said, it will be competing with some perspective that people have held for the longest time. How do you deal with this?
Wow. I would say we try to repeat the messaging. If we see something, let's say if it's about vaccine, because we're seeing a lot of concerns about, let's say, vaccine side effects. Something about vaccines and fertility keeps coming up, even before COVID. Even before COVID times, we still had health misinformation, just that it wasn't as pronounced as it is now, where health misinformation is what everyone is talking about. So we try and tell people, this is why people maybe would share, let's say, vaccine misinformation, and tell them to get their what is it called? Information from accurate sources. From reliable sources. And these are the dangers of actually spreading false information. And another thing, we keep emphasizing the need for digital literacy, because we cannot always be there 24/7 to check each and every piece of misinformation that is circulating across the countries that we are, because we are doing this across the continent.
I agree with you completely. I am simply saying that since you do this on behalf of agencies that actually have the might to be able to understand some of these problems, you see, if you're debunking what has been presented, and yet it has a beginning that is not always inherent in what you have, you may not achieve the results that you want. And I'm saying that it's these organizations, whether it's WHO, whether it's Gavi, that's what they do. They have the might, they have the ability to actually understand why these things arise. Because if you don't, then it doesn't matter how much effort your organization makes.
You'll always be playing catch up,
Yes.
and you'll not be believed.
And that particular myth and misconception will just be waiting for a new situation to rear its head.
Kenya's biggest conversation, The Situation Room with Eric Latif, Nduoko CT Muga. And our guest this morning is Ngengere, social content editor with Viral Facts Africa. We are fighting the COVID infodemic, as she called it. There's so much misinformation going on around this COVID pandemic that it's also now become a pandemic of its own, on its own. So we actually want you to participate in this conversation. Tell us, what information have you come across about COVID that you feel needs confirmation or clarification on? And Anne can help us, even as she goes back. She can help us debunk this, clarify this, and let us know whether this is real or not. 0719-012-600. Before we went to the break, and CTU was actually raising the same issue again on the information that have, the organizations that have information, the organizations that, for example, work in the healthcare space, that have the facts. You know, for a very long time, outlets for information were known. It's print, it's broadcast, it's radio, TV, it's newspapers, it's magazines, it's pamphlets, it's meetings, public barazas, and then there's going to be some bit of misinformation here and there, but it'll not spread far because it's contained within a small area. But now we have social media where a small bit of misinformation starts here, and within an hour, it's spread across the country. Now, those that were working in this space before knew, okay, so we will pick out some issues here and there. We will then write to the media, or we will print pamphlets and we will distribute them in health facilities, and we'll hold public barazas. We'll call the chief to help us. It appears they haven't caught on to what's happening. They're not staying ahead of the curve.
She's agreeing with you.
You agree?
No, I'm waiting. Yeah,
You're waiting for the question?
Yes.
Now, here is the question. Here is the question. What tools can these organizations use to stay ahead of the curve, to make sure that then the information that's out there is already the correct information that is running ahead of misinformation?
Okay, I agree that there's still a lot that needs to be done to be proactive and stop the spread of misinformation. So one of the things that I said we are doing is trying to explain the things that we see before the misinformation starts circulating. When we launched, because we launched in March this year, so it's a relatively still new initiative, we are now trying to look at other ways that we can still communicate accurate information other than doing that on digital platforms. So we are looking into ways that we can engage influencers or influential people who are trusted authorities in either both offline or online and offline, just to reach underserved audiences who may not be able to currently access the information that we have. We are also looking into ways to collaborate with traditional media to kind of amplify the messages, the accurate information that we have, because the audiences in mainstream media are quite huge and people trust these organizations. So we're also looking into ways that we can do that, just to have more people get accurate information and kind of tame the infodemic, because it's been a problem. Yeah, it's been a problem.
What are some of the dangers that we see? And I think a lot of times this becomes very real when you look at the dangers, things that could potentially happen with the proliferation of this misinformation. So what are some of the things that could happen? Because a lot of people see it as harmless. Okay, so what? I put something out there. Okay, it turns out not to be true. Then we move on, right? So what are some of the dangers that we could potentially see from things like this coming about?
The dangers of health misinformation. One, we've seen people dying because you're told this is an effective. If you take this, you will not get COVID. Or if you have COVID, take this and then you will get cured. Then you see people dying because they are taking things that are toxic. Number two, people, still the same thing about prevention and treatment, but it is not effective. It is not enough. So you see people adopting remedies that they have seen being, pushed on social media, but they get sick, they try this, it is not effective, they die because they did not get effective treatment. Number 3, things about vaccine, because now 2020 was mainly about prevention and treatment. Now most of what we are seeing is about vaccines, the misinformation we are seeing. So you see a lot of vaccine hesitancy because people say, hey, I saw this on WhatsApp, so I'll not go and get vaccinated, And unfortunately, the things that they are saying are baseless. They are untrue. They are false. But they will believe and they will say, I wanted to go, but now because I've seen this, like you've seen so much of this information saying, I was actually thinking of going, but now because I've seen this on social media, I won't go. And it's really unfortunate because it is untrue, most of these things that people are circulating online. Yeah, so the consequences are dire, like they're there. And as Siti said, we have our work cut out for us. Yes.
One of the things that what we are calling misinformation does, it isn't just simply misinformation. It builds on and it enhances existing misinformation. Because it's like misinformation has its own culture. And I'm going back, it has its genesis. You see, if you're inclined towards believing a certain source, or you're inclined towards something that we refer to as conspiracy theory, anything that seems to be a little off the well-trodden path, your spirit and heart welcomes it, okay? The fact-checking and the reliability come later, but it resonates with the way you look at life. Now, if, again, as I was saying, facts or the lack of facts in this case are given that free proliferation, forget stopping it. You are actually building on what has already existed. And with time, it becomes even harder. Because with a new situation such as the one we have with COVID, all you've done is you've given it a new lease of life in a new arena. And in so doing, you've opened it up. When something else comes up, it'll be easier to believe. I mean, we have 2022 coming up. Now, this has nothing to do with health. It sometimes borders on health because politics has a tendency of doing horrible things to our lives, which really messes up our health. But misinformation is more than rife in that particular sphere. And it will build up, it will increase. Remember, it bothered us so much so that we even set up commissions that dealt with what you call truth and reconciliation. Why not just reconciliation? Why do they bring in truth? Because an absence of truth is probably what got people into that position that they're in. So the very concept and the industry of misinformation, I'm calling it an industry because it's something that affects our everyday life. And you cannot disassociate myths around political situations and social situations from the health ones. They all tie in at some point. They feed into each other, and that's why they're so difficult to deal with. Yes.
And I'm also going to go to one of the biggest pieces of misinformation that came about, and this was the very day we found out the first case of COVID in the country. And I thought it was something that had now disappeared, but just a few days ago, I did hear something extremely worrying. And the first was, so the piece of misinformation was that COVID doesn't exist and that it was an avenue for government to then get funds into the country. Okay? Yeah. Today, there are still people who believe that this COVID thing is not a big deal, right? There's money coming into the country, and so therefore it can be explained. These deaths are probably from anything else. And if they had come up with this narrative that these deaths also, a narrative around them can also be created. I mean, it's convoluted, but it is the belief of very many people. Yeah. Has there been any work that you've done around this? Because it was a pretty big one. Yes. What kind of work did you do around this to try and get people on the right path, per se?
Yeah, that is very true. We have seen, and not just in Kenya, people saying this is just a flu. It will go. Others saying we have bigger things to worry about, like famine and such things. And also, that as Siti has said, the link to politics, where people say this is an avenue for government to loot funds. There is no COVID. So what we've done is we've produced Mythbusters telling people COVID is real. And we explain to them, okay, this is these are the symptoms of a flu. These are the symptoms of COVID-19. This is how they're transmitted. Like, these are the similarities, but they are not the same thing. So we do mythbusters for these kinds of things, where we see something is very, COVID is real. If you steam, there are those things that really, really stuck. Like, if you do this, you'll be cured. And also that one about COVID not being real. We have done mythbusters just to counter this and tell people this is real and this is why these two are not the same thing. Yeah.
How effective has that been?
We can see, people sharing the stuff, but in terms of impact, that has been a bit difficult to measure, because especially when this misinformation is circulating on encrypted platforms like WhatsApp, it's very, very difficult to know the reach, first, of the misinformation, and also how effective what you have done is. So that is something we are currently in the process of establishing with Stanford and UCT, just to kind of measure kind of impact that our work has on platforms, on social platforms. Yeah.
Do you, in your work, consider working with religious institutions? There's a reason why I asked the question.
Yeah.
Because if you talk about the believability factor, religious leaders hold a very, very huge percentage of that particular commodity.
Yes.
They are believable. People tend to believe them over and above social media, politicians, you name it.
Yes.
Yes.
Like I said, we are looking right now into ways of reaching underserved audiences, because most of these, unfortunately, yes, we started this to bridge what we were seeing online, but there's also a lot of misinformation offline. When you go to like rural areas and you hear the things that people are saying, but maybe this person does not have a smartphone, so they will not see what we have done. So we are currently trying to see who can we speak to, who can we reach out to in different countries, because we are not just doing this in Kenya, so that we can reach those people who may otherwise not be on digital platforms, people who will not have biases, because that's also another issue you need to think about, because you can pick someone, but they have their own perception of things, they have their own agenda that they would want to push. So that's something that is in the pipeline. It has not yet started, but it is something definitely that we are looking into.
You know why I mentioned religious leaders? This weekend I came across a religious leader, and we had a very fascinating conversation. I wish it was longer, but they do not believe that, they sincerely do not believe that COVID is an issue. And they refused to greet me with this clutched fist greeting. They said,
shake my hand or don't shake my hand.
And I told him, over my dead body.
Because it could be over your dead body.
Yeah.
Now, and it got me thinking, the sincerity of this gentleman struck me. But then what struck me further was the reach he has. Now, here is a religious person who has this belief. Now, can you imagine the people who listen to him?
Yes. And that's why I mentioned you need to be very keen when you're looking at the kind of people you would choose to amplify your content, because people have biases, and you could pick someone and then they go and do the exact opposite. If someone believes that COVID does not exist and they stand there and preach to hundreds of people on one day, and the others that they meet, because these people are influential.
You know what is even more dangerous? Not someone who doesn't believe it exists, but who believes that by virtue of their religious position and their faith and belief and
they're immune and protected.
Yes, exactly. That is the more deadly one, because
divine immunity.
Yes, that's what it is. They're not saying COVID doesn't exist. They're just saying, but that under these circumstances which I'm presenting to you, it has no effect on you. Now, that's what makes it dangerous.
Yeah, it is.
There's a study. It's a discipline. Communication is a discipline. Development communication is actually a study. And that's why I want to go back into those organizations and the professionals who work in development communication. For a very long time, we in communication have been dealing with just top down. You work in a media house, you are the one who tells the people, and you have no avenue for the people to feedback. I come in here and I say mtukufu rais hii leo amewachisha kazi bwana City Muga kutoka wizara ya fulani fulani, and that's it. Whether it's a truth or not, you'll only learn it was a lie when mtukufu rais takes me in. But now, in this day and age, things have changed. Communication is more collaborative. You have got to, it's a loop.
Yeah.
And unless we get to a point where we start thinking of how to get that loop working, instead of looking at information being spread as misinformation and treating it as an enemy, and saying, oh, there's something that's really disturbing. You know, when people are saying these things, what's wrong with them? Make it a loop. Those people who are spreading that information, there's a reason, and like Siti was saying, got to understand the genesis and the context of why they are saying that and believing and sharing. And if you don't work with that, then there's whole point of saying that you're fighting misinformation is futile.
I agree with you. And what we are seeing mainly is misinformation, like in Africa, is misinformation, where people do not necessarily share this with the intent to cause harm. They do not even know that what they're sharing is false. They then come back and say, oh, it wasn't true, you know. So that's why we're trying to promote digital literacy, to teach people, before you share, do this. That is at least for misinformation. Disinformation is a whole other complex thing to deal with, because these are people who have made it their mission, you know, to create misleading information with an intention. Now that's a whole different thing. And like a couple of months ago, we saw a report say that 12 accounts were responsible for over 80% of the misinformation that was flowing in the States. Yeah, something like that. There were 12 accounts, you see? So we kind of want to focus on misinformation, tell people, read beyond a headline, because sometimes these headlines, like you've said, they prey on your emotion. They want to elicit a reaction from you. You're like, oh my God, have you seen this? Before you even read the article. Promote digital literacy, so that in the event that the ones who really want to cause panic, you know, and instill fear in people, create this content, then people will already know, okay, I need to do this to check if this is true or false. Then that way, you can kind of see something slowing down, the spread of misinformation slow down, because people then know that don't just take things at face value. When you receive this on WhatsApp or on Facebook or wherever, think twice. Read the headline. Read the
headline before you share.
Yeah, read it before you share. If it's an image, can you check this? Because we saw an instance where a video was circulating very widely in many countries. And they were saying, this was taken in India. People are stoning the vaccination teams, you know, after they learned that the vaccines are causing, you know, COVID and all that. And just using the tool, you do a Google reverse image search. That is totally, it was taken out of context. It was not taken during that time. Police were dispersing a crowd that was, you know, for a totally different thing. But people believed, you know, vaccines are bad now because you can see what is happening in India. The video was not manipulated, yes, but the context, totally. But it had already gone viral. So you see, you need to teach people before you just circulate something. Check. Yeah.
There's also another focus, and I think even the last time we had this conversation, I was also raising the same. I have a bit of a problem with too much prescriptive dealing with this. Disinformation is dangerous. Disinformation should be dealt with by the law and law enforcement. Misinformation is community. Community has dealt with information from the beginning of community. This is how we live as a society. Every waking hour, you are dealing with information. Whether it's your child lying to you that they were not given homework, and then how do you determine whether this is truth or... We are constantly dealing with determining whether what we are consuming is real or fake. Now, when we become very prescriptive on, you know, these are the stages we should be taking. We should, you know, conduct literacy. We are interfering with the normal cycle of a community instead of basically working with that community in that cycle to provide information. If we focused on share the information, share the information that is real as widely and as often as possible, then in my opinion, you'll also be able to be dealing, eventually you'll be dealing with the misinformation. Because people know, I want to give you an example. Before this social media, how was misinformation happening? Misinformation would happen from influencers, bloggers. Those bloggers were not on digital. Those bloggers were this one person who is in this village who gets up every morning, listens to BBC, listens to the KBC News at 1, listens to BBC again at 6, reads the paper, gets the paper, and then he sits at the town center.
Becomes the town crier.
And yes, he's the one who gives information. Unajua City alifutwa na hesabu, unajua amekuwa akiongea na Mwakenya sana. Maana anafutwa kazi huyu. That becomes the blogger, and that becomes the person that people start following for information. But people eventually learned how to deal with City. How to tell when City is telling the truth and when City has added a bit of salt. And they can tell you, if you see City fidgeting on the seat like this, he's about to lie.
A falsehood is on the way.
It's people learn how to deal with the misinformation eventually. And I think that's what we should be doing.
Yeah.
Share a lot more of the facts.
Yes.
Share a lot more of the information about how do you know that this is true or false.
Yes.
And stop saying that you're fighting misinformation. You'll not fight that blogger.
But consider misinformation spreads and holds root because people believe it to be true. Communities thrive on the truth. They actually enjoy. And if you look at even societal prominence, everything that we do is actually based on the truth. People like the truth. Well, sometimes. But
Oftentimes.
But the reality is, so long as what we know as misinformation is regarded as the truth, that's why I said your work is cut out for you. Because you are not trying to dissuade someone to look at something differently. You are trying to tell them that this truth that they have held as being sacrosanct isn't the truth.
Isn't the full truth
Yes.
and nothing but the truth?
Yes.
There's something.
Can we get to the point where people will actually get a piece of information and then apply a grain of salt? Would you, a pinch of salt, would we be able to do that? Or should we be at the place whereby we're just allowing things to sift through and then people realize what the truth is? Can we get to a place, really, as you see it now, that I get a piece of information, whether it is on my phone or whether somebody whispered something into my ear, then I'm actually analyzing it first? Or am I consuming it first and then analyzing it later?
Yes, I think we can get to that place because as a fact checker, because I've been a fact checker with a different organization previously, we've seen people actually start to ask these questions before they share something. And they ask you, is this true? And others recently calling out a major publisher about COVID information, where they were being very sensational in how they were reporting, so-and-so has tested positive and they've gotten the vaccine. And people are like, but this is how it works. So you can see people are beginning to understand these things. And they will call you out when you are being misleading or not being very accurate. So I think we can get to that point where people actually analyze before they.
Sure.
Yeah, it's a journey though, and it's slow and it will take time, but I think we are getting there. We
I
are
think it's
seeing
organic.
improvement.
But already we've been there. The
Yeah.
only difference here is there's a new platform.
Yeah.
So people are just learning to work within the platform and saying, okay, so how now do I know the information is real? But already we have dealt with fake news in other platforms. You deal with fake news in the estate. When somebody comes and says, kulikuwa na wizi jana. You don't just take it in face value. You're like, but I didn't hear anything.
Yeah.
So which house was
Yeah.
attacked? So what did they take? And if the person appears to be, stammering and all, you're like,
Yeah.
there's something here. Before you call and said, I hear there was a robbery last night in this estate. You have asked a bit of information.
Yeah.
Same, I think, is happening. It's starting to happen in social media.
Yeah.
And maybe we just need to have some wind to assist it in getting this a bit faster.
Yeah.
So we want to thank you very much for joining us today, Anne.
Thanks for having me. Thank you so much.
So as you go now to work and you have all this work cut out for you, like City is saying, come across some information that you think needs to be clarified and need to be set straight out there, this is a platform to use.
And as we will invite you again, fact check the traffic next time.
Oh wow, yes,
Mombasa Road can be 1 minute clear, and then the next minute you made your decision based on information that you had, and then you get on the road and it's a totally different experience.
That was my experience this morning. It was totally different, but at least I made it on time.
Yes,
you did.
Yeah, it was great having you.
Yeah, thank you so much. It's been a great pleasure, and I would like to ask your listeners, if you see something that you're not sure about, send it to us at Viral Facts Africa on Twitter. You can use the hashtag VFA Check to ask us a question or send us a direct message. On Facebook, follow us, Viral Facts Africa. We're also on Instagram at Viral Facts Afro. Yes. So if you have a question, hashtag VFA Check, hashtag Viral Facts Africa, then we can answer your questions.
Thank you very much, and
yes. Thank you so
lovely
much.
day.
Yeah.